Bruxism, lip biting, nail biting. Bruxism definition: non-functional movement of the mandible with or without an audible sound occurring during the day or night. There are two types of bruxism. One is daytime bruxism and one is nighttime. Daytime bruxism. It is conscious or subconscious grinding of the teeth usually during daytime along with parafunctional habits such as chewing pencil, nails, cheeks and lips. Nighttime bruxism. Nocturnal bruxism is the subconscious grinding of the teeth characterized by rhythmic pattern of masseter EMG activity. Etiology: CNS. This phenomenon was found in children with cerebral palsy and mental retardation. Physiological factor: teeth grinding could be a manifestation of inability to express emotion such as anxiety, rage, hate, and aggression, etc. Occlusal discrepancies: improper interdigitations of teeth may lead to bruxism. Genetics: children of bruxism parents and increased incidence of bruxism. And occupational habits: and over-enthusiastic students or compulsive over or receiver competitive sports lead to clenching, which may be significant. Manifestation: bruxism can result in tooth mobility. Bruxism might be an essential factor for the factors for spread of gingivitis into deeper periodontal structure and alveolar bone loss. Bruxism can lead to an increased tooth sensitivity from an excessive abrasion of the enamel. A occurrence for chronic headache have been reported because of muscular contraction, grinding and tapping sound, soft tissue trauma, small ulceration on the buccal mucosa opposite to the molar teeth. Treatment: occlusal adjustment and occlusal splint. Vulcanite splint have been recommended to cover the occlusal surface of all the teeth for bruxism. TMJ disorders are prevented by the patented aerofoil shaped base and a double mouth guard design. Restorative treatment: pulpal therapy with full coverage stainless steel crown is indicated. Psychotherapy: counseling the patient can lead to a increase in tension and also create habit awareness and to reduce the tooth parafunction. Relaxing training: tensing and relaxation exercise, voluntary relaxation, hypnosis and behavioral conditioning can reduce bruxism. Drugs: placebo, vapocoolants, ethyl chloride for TMJ pain, tricyclic antidepressant, diazepam anxiety and alteration sleep aerosol, sedatives and the muscle relaxants. Biofeedback: positive biofeedback for learning of tension reduction. Lip habit definition: habit that involve the manipulation of the lips and the perioral structure are termed as lip habits. There are two types of lip habits: wetting the lip with the tongue and pulling the lip into the mouth between the teeth. Etiology: malocclusion in Angles Class 2 Division 1 with a large overbite and overjet. Habits: the habits can occur in conjunction with either other habits like a thumb or digit sucking. Emotional stress: children in stressful situation have an increased salivary output, thus increasing the number of swallows and lip seal required. Manifestation: protrusion of the maxillary incisor and retrusion of the mandibular incisor. Lip sucking can recognized by redal, irritated and the chapped area below the vermilion border. The mentolabial sulcus become accentuated and the lip sucking and the lip biting can maintain an existing malocclusion. Correction of malocclusion: in case of class 1 malocclusion with increased overjet, fixed or the removal appliances to the tip of the teeth back, treating the primary habit and the appliance therapy and lip bumper. A lip bumper may be used as an adjunctive therapy in both comprehensive and interceptive treatment regimen. Nail biting. Nail biting is one of the most common habit in children and adults. It's a sign of internal tension. Age of occurrence of nail biting is absent below the 3 years of age. The incidence rises sharply from 4 years to the 6 years and remains at a fairly constant level between the 7 and 10 years and rises again to a peak during the adolescence. Effects. Dental effects. The common effects are crowding, rotation and attrition of incisal edges of mandibular incisor, and effects of the nail is the inflammations of the nail and nail beds. Etiology. Persistent nail biting may be an emotional problem. After the age of 15, the nail biting habit is replaced by pencil biting, hair twirling or gum chewing. Management. Mild cases, no treatment is indicated. Avoid the punitive methods such as scolding, nagging and threats. Treat the basic emotion factors causing the act. Encourage outdoor activities which may help in easing tension. Application of nail polish, light cotton mittens as a reminder. Thank you.